Number 2 is a fibroadenoma. This is another very common benign or non-cancerous condition that causes a lump in the breast. It can also develop at any age, but more often it's found in younger women and teenagers. Apart from feeling smooth, it moves around easily under the skin, earning itself the nickname the breast mouse. Sometimes just before a period, you might experience pain around the breast from the fibroadenoma. We don't know precisely what causes fibroadenomas, but the hormone estrogen may have a role. It is formed from tissue or cells growing over a lobule in the breast to form a solid lump. Now, there are different types of fibroadenoma. You may have a simple one where the size is about the size of a pea or between 1 to 3 centimeters, or a giant fibroadenoma that grows to more than 5 centimeters, and that type is common in pregnancy or when breastfeeding. If the fibroadenoma happens in teenage girls, we call it a juvenile fibroadenoma. But if you have more than one, then you're said to have a multiple fibroadenoma. Lastly, some women have something called a complex fibroadenoma that is different from the other 4 I've just mentioned. When you look at it under a microscope, some of its cells look different to each other. Now, having a fibroadenoma does not usually increase your risk of breast cancer, but the complex type may slightly increase the risk of developing breast cancer in future. So, if it's a fibroadenoma, after diagnosis with a scan or mammogram, you may need a biopsy, especially if you're over the age of 25. A biopsy involves taking small samples of the lump and looking at them under the microscope. Most fibroadenomas don't need treatment. You'll be asked to keep an eye on it to check if it's growing, to keep examining your breasts, and return to your GP if anything new develops. Surgery might be considered for complex, giant, or even juvenile fibroadenomas. It could be under general or local anesthesia. Essentially, most fibroadenomas will stay the same size. Some get smaller and eventually disappear with time, but some can get bigger, like we've said, and this is more common in teenage girls during pregnancy, breastfeeding, or in a woman who's taking HRT.